My name is Dr. Naveed Final. I'm a consultant physician and chest specialist here at Avenue Hospital. I would like to talk to you about our newly launched pulmonology or pulmonary clinic that we just started this month. My role here at the hospital is to see a wide range of medical patients, primarily patients that suffer from lung diseases. Some of these lung diseases are asthma or allergic diseases, chronic diseases like chronic obstructive pulmonary disease, or other kinds of lung diseases like infections such as pneumonia, tuberculosis, fungal lung diseases, as well as patients that suffer from a wide range of chronic diseases that tend to involve the lungs. Some of these diseases are rheumatoid arthritis, autoimmune conditions, cardiac conditions, and a wide variety of other illnesses. What we have here is actually a spirometry machine. And one of the things we offer at Avenue is actually pulmonary function testing. And we do this using a machine called a spirometer that can measure the lung volumes. And we can also use an inhaler to do something called a bronchodilator challenge. So this we use to diagnose patients with asthma or other kinds of airway diseases. And we now use ultrasound technology routinely in the clinic to help diagnose patients with lung pathologies, for example, fluid in the lungs. And we also do ultrasound-guided interventions like insertion of little tubes in the chest, biopsies of lung tumors, as well as monitoring different kinds of diseases. And this is done actually right here. One of the key things we do in pulmonology is procedures like bronchoscopies. It's not done obviously in this office, but it's a procedure where we put a little camera into the lungs so that we can identify different kinds of diseases. We can collect tissue for sampling, and we generally can make a more accurate diagnosis. We do bronchoscopies routinely during the day as day cases. We also do them on patients who have been admitted or in the ICU for critical patients. Our work also extends to the intensive care units, where we play a role in managing patients on ventilators or who need some form of respiratory support, managing patients with pneumonia and what we call is respiratory failure. So you can see that pulmonology actually is a very busy field. It's a new service that we've started at Avenue. Spirometry has just been launched and our bronchoscopy suite is up and running. I would welcome you all. Make your appointment, especially if you feel you suffer from any kind of lung disease or if you generally need a checkup.